What's up, everybody? Welcome to NWA Nurses with Attitude. Leanne and I want to throw a quick shout out to the listeners. Thanks for tuning in. We appreciate your support episode after episode, and we hope you guys enjoy this content as much as we love making it. If you guys want, go check us out on our social, Nurses with Attitude on Instagram. That's where you'll find all the updates you need, and also shoot us a message if you want. Enjoy the episode, guys.
Hello.
Hey.
Hey, you don't sound that bad.
Yeah, thanks. Honestly, I've been spending time coughing, taking Flonase, doing stuff, so I sound a lot better than I did earlier.
We'll take it easy today, and
Leanne, there's no
have a
taking it
chatty
easy. I can't.
episode.
Especially in these chatty episodes. If we go on a cynical topic and I start going off, it's done. It's
Honestly,
over.
like I'm like, what are we going to talk about? But then the conversation just flows and we get into these random topics, and like these are always my favorite to record. But tell me about how up north was. How I guess you're like pretty run down, eh?
Yeah, so this was like my last contract that I have booked, and I've decided it's gonna be my last contract for a while. And
Yeah.
I have no mixed feelings. I'm very happy about it. I don't think Northern nursing is for it's not for everyone, and I'm not saying that it's not for me, but I don't think it's something that I can do on a very like regular basis. There's some nurses they have their whole like routine set. They go home for 6 weeks, they're on for 6 weeks, or like they're on for 3 months, they're off for 3 months, whatever it might be. And that life's just not for me. It was a great experience. I learned so much about Canada, so much about nursing. It's like a whole new side of nursing.
Yeah.
Working in like these health centers and even the long-term care homes down there. Um, um, so it was a really cool experience. 24-hour darkness kind of sucks, but it is kind of cool to experience. On the way back when I saw sun for the first time, I was a little emotional. I was like, whoa. And
Yeah.
I kind of had this realization, well, not even like realization, but just a thought. All winter, everyone is like, man, I can't wait till we get more sun. Wait till we get more sun. But down here, it's like, or sorry, I should say up there, it was like, they just can't wait to see the sun. Like it's
Yeah.
just not there. It's gone.
Right. And when you showed the pictures, I don't know if any of the listeners, Joe did share a picture on our Instagram. Um, you know, like you say, Joe, even here, like down in Alberta or wherever, Ontario, even, all our life, we're like, oh my God, the sun sets at 5 p.m. and blah, blah, blah. Like it's so
How am I
dark.
gonna
And
survive this winter?
exactly, right. And like we go through this seasonal depression, like I do for sure. I know that like if I don't get sunshine, it definitely affects me. And like I just couldn't fathom working somewhere where I would have to like get up in the morning, it would still be dark. I would work all day long, it's still dark outside, and then come home and it's still dark outside. I don't know how
Hmm.
you did it.
It's always dark, and then throw on like a brand new workplace. Throw on like you're meeting new people, like you're caring for like new patients every day. Um, Everything is like brand new. And
Yeah,
I've
it's
I've
just
only worked up north for a little while, so like the design and the care delivery of the health centers are still fairly new. Plus, you
mhm.
go to a different health center every contract. It's a lot to take in, and that's what I kind of realized last contract. Like it was a great contract and all, but you have to be on like your game, especially like
Yeah,
with with your supplements, because yeah, you're getting no sunlight. Like there's really nothing to
right.
do on your days off too.
Yeah.
Um, so you just got to make the most of it. Yeah, I took some pretty cool photos, guys. Go check them out. That one photo was when I first got there. It was almost like a sunset, but that's as high as the sun was getting. And then whenever I left, the sun peaked out just a little bit, but it looked like this like little fireball. Like
Yeah.
and it was very, very far away.
Yeah,
Um,
it's definitely a cool photo.
right. Yeah, it
Yeah.
was super cool. It reminded me of Dragon Ball Z for some reason. Like
So
when they do
funny.
like that fireball, like.
Yeah.
But
Oh
yeah,
gosh.
yeah, it was pretty sick.
I was just thinking that yeah, like the seasonal depression here like hits me. Like there's no way that I could ever um go through the darkness. But then also, Joe, like I worked as a float nurse. That was my position in Ottawa at a long-term care home, and like I would work on different units every day. Now, mind you, like being in the same facility, you know the routine of the facility, you know how to chart, you know how to do
Mhm.
everything. But different residents every day, different team dynamic every day. It's definitely tough, but imagine
Yeah.
like, well, I mean, you know, you lived it, but going to a different rural hospital or facility where like everything is totally different every couple of months. Like I think you've been doing this what since like September of last year? It's been
Since
almost a,
May. Since May.
oh, okay. So almost a year.
Yeah, yeah, pretty much. Like I was hired
Dang.
with the government since February of last year. So it's been a year that
Oh,
I've been hired, but I've been doing contracts up north, like actually going since like May.
dang. Why did I think it was not that long? But now that you say that, you would go and then take quite some time off, right? In between.
You know what? Not even like I so since May, I actually calculated it again. I've only been, and by the way, we're at this like we're in a new place, a new city. I'm in Saskatoon now, just moved here in May, and that coincided with my first contract. So I
Yeah.
wasn't even like present on my moving day. I was up in like far away up north. And I've only accumulated about 2 months of time since May at home. The rest have been up north.
What?
Yeah, so then like that's when I calculated that, I came to the realization I was like, this is great, this is awesome. I just can't wait to have a normal job again. And like I don't have to
Yeah.
travel 3 days to a community and
Yeah.
3 days home. And
Yeah, for sure.
yeah, so it's I didn't realize I was up there quite a lot. I had about 5 contracts since May. So
Dang. And were they have you like notified them that you're not going to go back? Are they upset? Can they find you work here or how
oh
does that
no,
work?
so it's like contract work. So I'm casual. So like essentially I'm not hired with the GN right now, the government
Okay.
of Nunavut. I'm only hired on contracts. So I really like if I want to like I can call them back a year from now. Like they're gonna still be sending me like their needs lists and stuff.
Yeah.
But I pretty much get to choose when I want to go back up. So it's nice, and I'm probably gonna go back up like um probably like next year or something, but just for like one little contract, and then
Yeah.
just here and there. And Jelena might be doing some work. So Jelena's in clinical psychology,
Yeah.
and she wants because she's doing her PhD to become a clinical psychologist, and they need clinical psychologists down there. All they really have for mental health are mental health nurses down there,
Ooh,
Leanne.
dang.
And it is pretty cool because I've never seen uh they're called RPNs, and it's super confusing because in Ontario RPNs
Mhm.
is registered practical nurses,
Yeah.
but everywhere else in the world RPN stands for registered psychiatric nurse.
And
And
I
it was
think that's an
cool.
RN though.
Yeah, so they're
Yeah.
the same. I don't want to say that they're the same level as RM, but yeah, like they're essentially a registered nurse,
Yeah.
but they specialize in psychiatric. So I think they
Right.
have a 4 year program,
Yeah.
um, and like they specialize. So like I don't know what it's like in the rest of Canada, but in Nunavut, there's certain drugs that like they can give and not prescribe, but they can give as per standing order based on their own
Okay.
assessment.
Yeah.
Um, and it was pretty cool like working alongside them. Even at that, there's still a shortage of mental health nurses up there,
Yeah.
so we were just thinking it'd be cool for Jelena to go up there and work as a clinical psychologist. The problem is that they super need a clinical psychologist, and Jelena wanted to go and do her schooling for clinical placements up in Nunavut, but they don't have one, so she can't go up because like
Yeah.
she has to like work under someone.
Mhm.
um but yeah, I think we're always just thinking of the future, and it's cool to have multiple doors that we can kind of choose from.
Right. What do you want to do with your RN? Do you want to get into the psychology like side of things? Like do you and Jay want to work together in the future?
Hmm.
Is that like the route you guys are going to take or
Honestly, like I'm never like I don't know if you know this or like if you see this, but I'm a very like just like go by like go with the flow of things.
Yeah, yeah, yeah.
But yeah, like I might do my master's, might do my PhD or practitioner in nursing, and
Yeah.
then we could maybe have our own practice one day where I can prescribe medication. And then like, cause she, as a clinical psychologist, you can't prescribe, but you can like
Yeah.
do everything else sort of thing.
Yeah.
So if I can have prescribing authority, like maybe one, like we have no idea, but we definitely do want to work together in the future, you know?
Yeah, I could see you working in mental health for sure.
I will take that as a compliment.
No, for sure. Like I think that you're a good listener. Like you're not the nurse that just like jumps down your throat with like, well, this is what we're going to do. No, you actually take the time to listen. And I think that's really important when it comes to mental health,
Mhm.
especially, you know?
Oh, for
Um,
sure.
but yeah, I could totally see you taking that route.
Oh, that's so
100%.
cool. Oh, well, I
Yeah.
really appreciate that. Yeah,
I don't,
honestly, it's so exciting, man. The future, and you're doing your bio's painful. Every time you text me about your
oh
bio, Leanne,
my
I like put my hand on my knee. I'm
God.
like, oh boy.
Okay, listen, guys. Like, if I'm not complaining about statistics, I'm complaining about some stupid course in the RN program. Like, listen, it's tough. Yeah, I'm really struggling to find motivation right now, and I think a part of that is also like the end of winter, like we're saying this like seasonal sort of drag out that we all feel. Not to mention like I know we've gotten into this, but I just don't have the motivation to like I work all day from my computer most days. Like some days I'm out in the community, I do see clients and stuff, but because I work from a computer all day long, like the last thing I want to do at 4 p.m. is jump on a computer to
Mhm.
study, you know?
Yeah.
Um, but
Do you have blue light blocking glasses? Like,
I do, yeah, because I'm literally staring at a screen like all day. And not to mention, Joe, since I've started the Epirus, which is for anyone listening, is the Canadian equivalent to Accutane. My eyes have been really dry, and I actually find that wearing the glasses makes such a difference when I'm looking at the computer screen all day long.
okay,
And I don't know
that's
if
really
that's just like
interesting.
placebo, but
Does it make them like less dry?
yeah, like
Oh,
I don't
very
feel
interesting.
the maybe not dryness. Maybe I'm just getting extra strain. I don't know. I've never really been someone who struggled with like dry eyes. Well, I guess from time to time, but not anything chronic, you know? And
Hmm.
so, yeah, I wear the glasses and yeah, I feel very studious when I wear them because I'm not someone that normally wears glasses. Oh gosh, but
You're kind of fit into that imposter syndrome a little bit, eh?
I just like put these glasses on and I'm suddenly this like studious, top-notch student. Yeah, right. I wish. Oh
Yes,
my
cranial
god.
nerve 17.
Man, I just yeah, school's rough. It's kicking my ass. They give you a year to do this class and I understand why.
Hmm.
I've seen people like posting on the Facebook group saying they did it in like 4 weeks. I'm like, what do you guys do?
Dude,
Like bio
stop.
12 hours a day? Like, pfft, no way.
They'd have to do it 20. I've seen the course load for. I was in that course and then I dropped out. But yeah, that's a lot. I
Yeah.
don't believe that. I call
I
bullshit.
just
Until I see it, I won't believe it.
I feel like the thing with bio is like a lot of it is obviously pre-knowledge from our PN program. And so like I can see why someone could like scoot through it. You know, I get it. It's much more in depth than it was from what we've previously learned. But if you've recently graduated from school like last year and then you're going right into this course, like yeah, I
I
mean,
guess so.
there's definite similarities. But I've been out of school for almost 3 years now, and like I don't know which cranial nerve does what and like which ones are sensory and which ones are motor and it's just it's a lot. I'm overwhelmed.
Oh man. And I think another important thing to note is like when you're doing Athabasca or like any online school, like you are the teacher. You're teaching yourself this stuff. Like it's
Yeah.
one thing. Like bio's hard in school. Like bio is probably one of the most challenging courses there is.
Yeah.
And even pathophysiology, like
Got that
it's the
next.
same. It's very difficult. But then you're teaching yourself, guys. Like she's literally reading the book and she's
Yeah.
the one telling herself and like making sense of it on, you
Yeah.
know, a realistic
There's
level. Like it's
yeah,
crazy.
there's no guide. The literal guide for the chapters, Joe, are the objectives. Like at the beginning of a chapter, they'll like outline the objectives of the chapter. That's what they give you as an outline. And I'm just like, really, like, you can't just throw me a bone here. Like, give me something. Anyway, I wish that, you know, I realize that Athabasca is like an online university and, you know, I'm over it. I'm sick of bitching about it. But I wish they did like online daily check-ins where like if you wanted to have even just check-in to play a certain chapter like slideshow or something,
Mm-hmm.
if you could just like check in and listen, like if they would just offer like an auto, I don't know if that's a thing you could do, but like an
Kind of like a
automatic
Q&A.
thing, not a Q&A where like you interact with someone from the college, even just like you log in and it's like an automatic like PowerPoint where you just sit and listen and it just like helps you guide you, you know, like
Okay.
not necessarily a teacher speaking on the other side of it, but just like, you know, then I could be like, okay, well, Monday, Wednesdays, and Fridays, I want to do my login. And like that would hold me accountable.
Yeah.
Does that make sense?
You're saying like a pre-recorded that you could like
Yeah.
follow along, kind of, so it would like mimic a classroom setting.
Yeah, essentially. And they're like, oh, well, on this week, we're going to do chapter 3. And then next week, we'll be showing chapter 4. So that it keeps people like on track too, because there's nothing keeping me on track. Like I could literally wait till the last week, write all my quizzes, all my exams in 1 week. Like there's nothing saying I can't do that.
Yeah.
You know, I mean, I'm not going to do that because that would be like absolute suicide, but
That'd be like bio roulette right there. Holy shit.
Yeah, honestly.
Multiple choice roulette, literally like 1 in 4.
And they're so sneaky and they're like test questions. Like one word will be off. Like instead of saying positive, it'll say negative.
Mm-hmm.
So if you just skim, you get it wrong. You know what I mean? Like you got to be.
You have to be like dialed in the whole entire time, like 100% time.
Yeah. And oh my gosh, I don't know if I told you this, Joe, but last time I tried to write my bio exam, they were like, there's malware on your computer. You can't write from this computer. And I'm like, what? Like, what do you mean? I haven't done anything. Like, it's just my normal laptop. I literally write every exam on this computer. They're like, sorry, you can't write your exam. You have 30 minutes to log in from another computer. And so I'm already like test anxiety times 100 right now. And now you're telling me I can't write my exam. So I'm like stressed. I'm like, oh my God, I get my work laptop and I'm like, let's just pray to God this old piece of junk works. Like I log in. They're like, yep, sure, no problem, blah, blah, blah. Everything looks good on your computer. They're like, okay, go ahead and write your exam. Yo, I was like totally out of it at that point because I'm stressing that I'm going to get a 0 on the exam.
Yeah.
If I can write it. You know what I mean?
Yeah, you must have been like your fight or flight must have been like going off. And then they're like, okay, just write it. And you're just like,
here you go.
Sweating.
Now focus on the questions. And it's like, okay, but you just fucked me around for an hour. Like, man, like, no, you can't do that. There's nothing wrong with my laptop. Like,
you gotta let me breathe.
Like, are you gonna report me to the college? Like, is this like a plagiarism thing? Like, is this what, like, I was stressed.
Yeah. So did they tell you anything else other than that there were just like malware on your computer?
No, that was it. I'm like, okay, great.
It's a little
So
weird.
my next exam, like, I guess I'm gonna try to log in on my regular laptop. Like, I don't know.
I'm concerned because what if you're hacked, Leanne? Like, what if?
Oh no.
What if they hacked into the NWA network servers?
No, maybe they'll do some of my bio homework.
Yo, hey, maybe they can be your teacher. You can just ask them on your computer.
Help a girl out. Oh my gosh. Imagine.
Yeah, straight up.
It's so funny. Okay. There's something I wanted to talk about today. And I know I texted you this. I think it was earlier in the week or maybe even last week.
Oh shit, I was supposed to remind you.
Yeah.
I know what you were about to say.
I'm on it today. So, Joe, I came to this realization that I have whitecoat syndrome.
Da-na-na.
As a nurse, I have white coat syndrome. For anyone listening, Joe, what's white coat syndrome?
It's when you start getting nervous when you see someone in a white coat, aka like a doctor or a nurse. You don't
Yeah.
actually have to be in a white coat to experience
No.
this. Like if you're in a clinical setting, so like you might go to the doctors and they might be like, "Oh, you always have really high blood pressure," but you might not be hypertensive. You might just have white coat syndrome, and you get really really nervous
Okay, this is
in this setting.
exactly what happened to me. Okay, so I go into my doctor, and I don't know if it's just from like maybe a little bit of trauma from like dealing with thyroid for so long and like having
Mm.
shitty doctors and people who don't listen. Like I've really been through the ringer in that regard. And so when I found a doctor here in Alberta, she's lovely. She does what I ask her to do. That's all I really want. Like, I know what I'm
Yeah.
asking for. But my blood pressure is high. Every time they have me go in, like I go in for an appointment or whatever, or check in or whatever, your blood pressure's high. Your blood pressure's high. And I'm like, okay, but I don't have high blood pressure. And they're like, well, you don't know that. I'm like, listen, ma'am, okay? I'm aware of the signs and symptoms of hypertension. I don't have high blood pressure, okay? She's like, I want to send you for testing. I'm like, oh, for the love of God. Like, what do you mean testing? She's like, oh, they'll like put a blood pressure cuff around your arm for 24 hours. You wear it for that 24-hour span. It inflates every 15 minutes.
I have not heard of that. Is weird. What?
Right? Dude, trying to sleep with this thing was
What?
awful. Yeah. Every 15 minutes.
Leanne,
And then,
is that just me or like we weren't taught that in school, and I haven't seen that in clinical setting yet.
no,
Like I
I've
understand
never
Holter
heard of this.
monitors,
Yeah.
but
I've
not
never heard
blood
of this.
pressure.
Yeah. This is
Okay.
like a 24-hour test. I'm like,
It's crazy.
so she's explaining this to me, and I'm like, you're really going to make me do this? She's like, yeah, I would prefer if you did. I'm like, oh, for God's sake, fine. So I do. I do this test, wear this stupid cuff. Like, I'm going around to see clients at work, and they're looking at me, and I'm like, just ignore the cuff and like the machine that's currently hugging my body. Like, sorry, And sure enough, my blood pressure is normal. And so when I'm in the office, Joe, and I had to go to a separate office to get this test done. And I looked at the nurse and I said, can you print out my results? And she goes, yeah, do you want to see them? I said, yeah, I do. And so she prints them out. My blood pressure was like 110 over 80, 118 over 78, like textbook. Perfect. Nothing
Yeah.
wrong. Absolutely. And I'm like, told you so. So basically, I came to this realization because I went back to the doctor this week, and it was related to getting a prescription filled, and she had never followed up on me about my results. And obviously, like, if you don't hear anything, that's good news, essentially. But I already knew. I'm like, you don't have to call me and tell me. Like, I already know that everything was
Yeah.
fine. So she goes, did you ever go for that blood pressure test? I'm like, yeah, I did. You told me to go, and I did it, and it's fine. She goes, oh, let me look at it. And then she looks at it. She's like, yeah, actually, your blood pressure's great. And in that moment, I'm like, holy fuck, I have white coat syndrome as a nurse. Like, which is so strange because at work, Joe, I'm the first person, like when I was working on the floor, to like challenge a doctor. I would be the first LPN on our floor to be like, whoa, you're prescribing this much Hadromorph? Like, maybe we should start with this. Like,
Slam the brakes here, doctor. Low and slow. You know the deal.
honestly, it's just like, I would push back for my patients, like my job is to advocate, and that's always been important to me. And that's part of the reason why I love the job that I do now. But when it's me under the microscope, I'm like, get me out of here. I don't want anything to do with it. And I don't know, maybe it does come down to just like being treated shitty for so long with autoimmune and all that. Like,
I think the key is you're in a different like setting. Like, sorry, not even different setting. Like you're in a different position of authority too. Like at work, like you're behind the scenes, but then when you go into a clinic to see the doctor, like you are the patient, like you're the client. Like it's different. You don't have power there, Leanne.
Well,
Like,
it's funny, Joe, because when I was at the doctor getting my prescription refilled, I told her that I was on Epuris. And she goes, oh, actually, I said oral isotretinoin is what I said. And she was like,
fancy.
oh, you're on Accutane? I'm like, oh, actually, it's called Epuris. And she kind of looked at me and I'm like, don't call it what it's not. It's not Accutane, it's Epuris. We don't call it
Uh-huh.
Accutane in Canada.
Yeah, you tell her.
And so, like, in certain circumstances, I'm like, no, this is what it's called. Not that it's like a big deal, but like, I understand that Accutane's like the more common name, but I'm a nurse and she knows
Mm-hmm.
that. And I was very clear about that when I like first found this doctor, because I was basically like, listen, okay, so like, I'm the nurse here and like, I just want you to prescribe me what I ask for.
Yeah, yeah.
um,
I have a question for you.
yeah.
When Ben goes to mechanics, does he have the same attitude? Because Ben
No,
is he's a mechanic, and I would just assume that mechanics
no,
do the same thing. No?
no.
So like
Um,
Ben doesn't go to the mechanic, and then like like he's never been in a situation where like a mechanic says one thing, but he knows like he's kind of like, well, like
um, so, well, Ben doesn't take any car to a mechanic because we fix our own cars, obviously, with his
see, that's
skills.
where my question was flawed. That's
Right.
the variable I
But,
didn't account for.
but, um, in the event that like when the Kia was under warranty, um, they would have like recommended maybe like an oil change every 10,000 kilometers. Let's just say here for to make a point here. Ben would have like advocated and been like, no, we want it done every 5. You know what I mean? Like he
Yeah,
would advocate, but he's not like blunt in your face like I am. Like he wouldn't just like um just say it how it is. Like, or
yeah,
even if he was working with another mechanic and they did something stupid, Ben wouldn't be like, well, no. He would take that as more of a teaching opportunity. Do you know what I
of
mean? Where
course, of course.
I'm not 100% like that. I like to think that a part of me does enjoy like teaching new nurses, and I did a lot of that at the long-term care home that I worked at, but like I would challenge things. But I
hmm
was never rude, you know?
I think you're supposed to challenge things. Like
It's my job. It's
we
our
work
job.
in and we work in a team, and people need to realize. I know some people they get very offended when you say anything that is against like what they're trying to do, and some people take it as like, oh, you hate me, or like, oh my gosh, you're trying to change everything. But I always tell people like this is an environment where we need to learn and grow off each other. Like, and if you're doing something that I see and I need to say something, I will say something, and
Yeah.
vice versa too. And I think, you know, the way that we say things are off, they can be perceived in a different way. So it's important to account for
Yeah.
that.
Mhm.
But yeah, no, honestly, Leanne, like that's what we have to do.
Yeah.
Um, especially and honestly, I'm really good with other nurses. I've only really had to step up against doctors actually. I've had to like,
Right.
and so I shouldn't even say step up because it like they were always very receptive, and I was receptive too of like their feedback. But because sometimes you get doctors who come into long-term care, and like let's say if they're ER doctors, they might not just be familiar with that setting, and sometimes it's like vice versa too. They're long-term care doctors that go into hospitals, and they're
Yeah.
just not familiar with the kind of way that they do things, because things do change uh in a matter of like what setting that you're in.
Yeah. Well, and too, Joe, like there's also an accountability factor to our licensing. And, we have practices in place that allow for this. Uh, I don't know what the word is, but my example in my mind is like narcotics, like or even any medication order. It's checked twice before we even send it to pharmacy. And then pharmacy reviews it and then it can be given. You know what I mean? Like there
Yeah.
was a time where I remember it wasn't even me that did the advocating, but my co-nurse at the time on the floor, we had a client, or I should say resident, that went palliative, and so we put in a sub Q line, and we were giving Dilaudid and by sub Q,
hmm
and the dose was, I think she had wrote 2 milliliters, but it was meant to be 2 milligrams. transferred to milliliter, so it's not the same. And so I don't remember the exact like numbers and stuff, but it would have been a huge dose to give this person. And yeah, my co-nurse caught it right away, and she's like, you meant to write ml, right? And then they did the calculation together, and like the doctor that we had was really good and was like, oh yeah, good catch, you know, because all it takes is like an ml or an mg that makes such a difference in medication.
Yeah.
You know, especially Dilaudid. And
Yeah, because
so
isn't it like, if you're using the little vials, it must have been the one mil is like 10 milligrams or something like that.
I don't know. Honestly, it's been so long since I've been on the floor, but yeah, it was, the dose would have been even too big to give via sub-Q line.
Like, it just
So
wouldn't have worked.
yeah, like you're not supposed to
Damn.
give over a certain amount right under in sub-Q. So
I think it's like a mil.
yeah, 2 mil, depending on where you work.
2 to 3, yeah, damn.
With a flush, yeah. So but all that to say, like, Joe, there were times where I would work on the floor and like I would see another nurse doing something and I would tell them to stop. Like, stop. And it's like insulin or something, you know? But then there were other times where, you know, I would see them do something and I'd say, okay, you know, you did this really great, but next time maybe try this. You know?
Yeah.
But yeah, like I say, there's a liability that comes with this position, and our role as a nurse is to advocate for our patients and to work with the doctors. And no doctor's perfect, no nurse is perfect. Things get missed. It is what it is. Wrong medications get given. It happens, you know. But like you say, Joe, like we have to work collectively as a team to mitigate the risks that come with giving medications to people. And yeah, there's just like a lot that goes on behind the scenes that I don't think a lot of like families know about. Especially, they're just like, oh, well, there's the order, like give the pill. Okay, well, there's a process.
There's a big process, yeah, and like critical thinking, and like with, you know, in terms of narcotics, narcotic count is huge. And I like in long-term care, when the one that I worked at, I'm sure it was the same at Pearly, narcotic count was a huge thing. And like the managers, I believe they did a wonderful job at like instilling it in the staff. Like our narcotic count, Leanne, like reminded me of like the freaking like Marines. It was intense. Like you'd go in, like we do narcotic count, and like everything had to be perfect. So I went to this other workplace. I was working at this hospital. It was like it was a new hospital, just built, and you know everyone's going to work. We're all excited, and there's no narcotic count. So I made a narcotic count. I took a blank. So this place was open for like 4 months, Leanne. And I get in there and there's no narcotic count. I'm like, that's not okay. So I took a blank piece of paper. I wrote down the narcotics. I made my own damn narcotic count. And I know people were probably looking at me like, oh, look at this like hard ass like nurse. But I'm like, I really don't care. If I'm coming on and you're giving me the keys to that cart, we're doing a proper narcotic count. And so eventually I went to the manager and we got narcotic, and she was like, there's no narcotic count. I'm like, you're the manager. Like, what do you mean? How do you not know this? Like, come on now. So we got so it's okay. We got everything set up. And then one day I was at work and there was narcotics missing. And the nurses was like, oh, well, yeah, I have no idea where they went. See you later. And I literally like jumped in front of her and I closed the door right in front of her to the nursery room. Like, no one's going nowhere. And she's like, what do you mean? I'm like, if you leave that door, I'm calling the cops. And she was like, what do you mean? I'm like, and Leanne, this wasn't like it wasn't like, first of all, any narcotic missing is a big deal. But there was probably like 30 milligrams of Statex, like morphine that was missing, that was gone. Like it was just gone, disappeared. And I'm like, someone took it. And I was like, if you leave that door, I'm calling the cops. And she's
Do you
like,
think
what?
someone took it, or they just gave it and never signed?
Well, mysteriously. So what happened was I was like, I'm gonna call the cops, because if I come on for this night shift, and I'm like, and she's like, no, you want? I'm like, girl, like, don't test me. Like, I will call the cops right now if you take a step out that door. And she was like, sign. And I called the manager. It was like 7:30 at night. Called the manager. She came in, couldn't find it, and then she went to go call the cops. Like, she was like, fine, I'm calling the cops.
Yeah.
Magically, oops, it fell behind the cart. Here it is. And
Huh.
we were searching that whole place, Leanne. Like we were searching it. So that's just a great example of like Leanne saying is you have to be like this is your license, that like that's your life
Yeah.
on the line, right? Like
Yeah.
if I don't know what would have happened, but if I would have just let that woman leave and then I go to shift report the next day, and let's say if it goes on for a week, no one talks about it, but then eventually someone's gonna say, "Hey, this drug went missing,"
Yeah.
and it's gonna come back. Well, Joseph and this nurse did count. We would both get in trouble because that's a due diligence that you have to do as a nurse, right?
Yeah.
So you just gotta like sometimes you have to put yourself in a situation where people might look at you and be like, man, like this person's being a hard ass, or this person's being like, wow, like look at them. But it really doesn't matter. Like you have to protect yourself, right?
I found that some of the nurses were resistant to doing a narcotic count. Like they're like, yeah, I already counted. Okay, but we count together.
Yeah.
And I used to have to like tell people that and they would get mad. So like I don't know what the problem is, but like I would
That's
go to
so
the manager
funny.
and I'm like, "Listen, like your nurses don't want to do a narcotic count." And I guess we should clarify that missing narcotics is like a huge deal. Like Joe said, calling the cops is a part of the steps to recovery, and like an investigation happens. Like it's a huge thing. Um yeah, like you can lose your license. It's a huge thing. And
Mm.
so, especially for facilities that still use like paper mar, I find that I don't know, sneaky.
Yeah, like some I like like I'm not here to gossip on here, but you also have to be this wasn't a lived experience myself, but when I had went to this home that was really, really strict, they had previous, someone who was taking narcotics, and
Yeah.
you went on that unit, and almost every single resident was on narcotics, on PRN
That's
narcotics, and a
that's the
lot of
thing
them
though. Like
like
why? Why do
and
the doctors like
well, and this is the thing, a lot of our job was like I'd go on and I'd call the doctor like this person, we don't need to have hydromorphone for this person, they do not need it, they do not
yeah.
need hydromorphone. And and like you always want to go up the ladder, like start with Tylenol, okay, PRN, and then if
Yeah.
they're taking Tylenol like 3 4 times a day, make it a routine Tylenol,
Yeah.
see if that works. That doesn't work, then add on like a PRN anti-inflammatory. Okay, that doesn't work, make a routine. If it's arthritis, there's some arthritis medication you can get. If it's gut
Yeah.
issues, you can get like some gut stuff. But narcotics should be like the last line of like,
Not to mention, like, you can use hot and cold therapy as well on top of this. Like, we had blanket warmers on our unit,
yeah.
which would, like, people would, I would give a warm blanket to a resident who had a sore back, just tuck it under their back, and they would be like, oh my God, this is the best thing ever. Like, wow, what a thought. We didn't have to give you meds. Like, I think, and like a physio referral should be done. Like
Yes.
dietary needs to be done if it's like a gastro or a tummy related thing or anything. Like
Assessment. Yeah, yeah.
there's so much more to just like, yep, here's a 0.5. Like, no, I don't know. But then other times, Joe, there were doctors that wouldn't give the hydromorph, even though we've done all the things. And that was frustrating because you, as the
Mm.
nurse, know when someone you can tell when they're in pain, and then the doctor comes around and sees them once every month. It's like, well, you don't see what they're like Monday to Friday,
And you don't see what they're
you
like at
know?
night, because sometimes pain can come
Exactly.
on stronger at night, especially if it's like musculoskeletal pain, like
Yeah.
laying down in a position.
Yeah. And like not being able to shift your body weight.
Yeah.
I think about, I don't know if we did this in PSW school or if we did this in the nursing program, but we had a prof that was like, I want you guys to sit in your chair for 2 minutes. Do not shift your body weight. Sit on your bum cheeks. Don't move. See if you can make it to 2 minutes. And basically, this was to show us that, we freely, unconsciously, voluntarily shift our body weight from bum cheek to bum cheek. We scooch forward in our seat. But someone who's sitting in a wheelchair, can't necessarily do that throughout the day. And so this was to
Mhm.
like reiterate the importance of repositioning and skin care and all of that, right?
Yeah.
And that's always really stuck with me. Like when we talk about like the patients who have pain at night, like they're laying in one position. If they're not repositioned throughout the night, sure, they should be on an air bed, first of all, or an air mattress, but they should be rotated throughout the night, every hour or 2 hours, whatever. Even an hour to me would be like, I don't know, man, sit on your ass in one spot and don't move for 2 minutes.
Mm-hmm.
Tell me that's not uncomfortable. Like you're itching after 30 seconds to just like
Yeah.
move your leg, or you know what I mean?
Yeah, that's a really cool like thing to do. We definitely didn't do that in the nursing program.
Oh, that must have been the healthcare aid program then. But yeah, that stuck with me for sure.
And like if you think about it too, sometimes, we think we're doing good and we put like 5 blankets on someone. But if they can't take those blankets off, like we all get hot during the middle of the night and then we take the
Yeah.
blankets off and then we get freezing cold, like we're in Antarctica, so we throw the blankets back on, then we stick one foot out. Like some
Yeah.
people don't have the ability to do that.
Yeah. Not to mention like the pressure of blankets on someone's feet that are swollen and they can't move, like on their toes,
Mm-hmm.
Like these are all things that people don't really think about, but I don't know. This is what we were taught in PSW school. I also think that I'm like a firm believer, Joe, that being a healthcare aide before or PSW before being a nurse gives you like a one up. And I'm not saying that like I know that you weren't technically a healthcare aide before, and I'm not saying
Mm-hmm.
that like you're not a good nurse for that, but I just think that it
I
it
know that.
helps you like it helps you see things from a different perspective.
Yeah. Oh, for sure. For
Yeah.
sure. Well, and I think it was so eye-opening when we, like, for me, because I wasn't a PSW or really in the healthcare field at all, when we did the placements for when we first went into like nursing. But
Yeah, 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 yeah.
I would have loved to get a lot more of that because it's really foundational stuff, and I feel like they just kind of throw you in. Um, you do it real quick and then you kind of
Yeah.
move on, and like there's an element of it, as a student nurse, when you're on the units and you see a call bell, even if you're in your like second year, you want to be that person going to get the call bell, because in my eyes it just shows your work ethic and your dedication to helping
Yeah.
them out. They're in my eyes, like, the people who are working there are doing you a favor by like teaching you and letting you be in the facility, so the least you could do is do like the grunt work, right?
Yeah.
So you do get that like PSW training throughout the program, but I would have loved to get a lot more, because I think what Leanne's saying is true. Um, yeah, it's true. And even as a nurse, Leanne, like when I started working in long-term care, I was working with PSWs who worked there for like 30 plus years.
Mhm.
They are extremely intelligent,
No,
like
I know.
education level guys. Like these people have lived experience, and
Yeah.
they know like a lot. And I would say some people knew a lot more than me, and I would look at my PA, like I would look up to them, and I'd ask them questions. Hey, this is the situation, like what do you think we should do? And they're like, well, let's reposition, or move them like this and do
Yeah.
this. Oh, and this. And plus they know these people as well. um
Yeah.
yeah, I don't think, and we spoke about this before, I don't think PSWs get enough credit that they deserve. And I think
Yeah, no, they
nurses
don't.
like yourself, Leanne, and other nurses who have that training, they come in at a bigger upper hand
Yo,
to
it's so funny because
nursing.
you bring up this placement and like it was 2 weeks, I'm pretty sure at the beginning. And I skid through that. I was like, this is a joke. Why do I have to be here? I did this for 5 years. You're going to teach me how to wipe someone's bum? Like, give me a break.
Holy
Like,
fuck, I was traumatized. I was fucking traumatized
I
that
was like,
first week. Holy
it's so
shit.
funny because I was like, this is a joke. You know what I mean? Like, why am I not exempt from this? This is like
Yeah.
basic knowledge in my eyes because that's the job I've done for 5 years, man. But the thing is, Joe, is that regardless of your like prior experience or whatever, I've always, as a nurse, encouraged my healthcare aides to think on their own. And so, like, when a healthcare aide would come to me, they would say, oh, this guy, I took him to the bathroom and he's bleeding. I'd say, okay, what have you done? like, I don't know, he's still sitting on the toilet. And I'm like, okay, take a cold compress, put it on his bottom. Is this someone that suffers from hemorrhoids? Those were always kind of my first thoughts. Was he bearing down when he was trying to poop, And they're like, oh, yeah. I'm like, okay, do you know if this guy has cream for that? Oh, yeah, he does. Okay.
There we go.
Go ahead.
There we go, Sandy.
Compress. Go ahead, do your cream.
Building a story,
I don't
yeah.
need to be there. Like, it's like a queuing. And I understand that, like, a lot of healthcare, they don't really teach you that kind of stuff in school. It does come with experience. But to me, like, the responsibility of a nurse is to guide your team. Like, you're not just there to, like, it's funny. I was going to say something, but I also want to say that, like, when I was a healthcare aide, I would always be like, oh, I'll have to ask the nurse. Like, if I didn't know something, I would be like, oh, I don't know. Like, I'll ask the nurse. Or if something was difficult to answer, or if a client was, like, being rude or whatever, I'd be like, oh, I don't know. I have to check with the nurse. I would always blame the nurse. But now that you're the nurse, it's like, you need to guide them through the thinking process that you have gotten through your schooling. You know what I mean? It's like, oh, this guy has pain to his knee. Okay, well, when was the last time he was repositioned? Does he have Voltaren cream? Did you put the Voltaren cream on? Is there broken skin? Like, I would ask these questions, and I'm like, can he still move his knee? What was he doing? Did he step down funny? Like, I would have a conversation with them, and, like, usually 9 times out of 10, Joe, it would just be like, okay, great. Now you know what to do. You know what I mean? Like, you don't need me to come there to do it.
100%.
Yeah, but
critical thinking is so important. And when you get a good team and, like, you can grow with your team,
we had
it's
such
actually
a good team.
so awesome. Yeah, I miss my team. Like, I miss it was great. You work a day with these, you have with all of you, there's about 6 or 7 of you, and it's just great, man. You're all working together, and it's cool.
Yeah. And sometimes, like, the healthcare aides wouldn't want to do the dirty work, or, they couldn't get someone to help with the transfer, but they always knew that, like, certain nurses would help, but certain nurses wouldn't. And so, I feel like I always made myself available to them. And I feel like, I always wanted to be the nurse that the healthcare aides, I always wanted to be the nurse that I wanted when I was a healthcare aide. Someone that would guide me, someone that would help me if I needed a transfer. Not like, I had so many nurses where I'm like, can you just help me rotate him in bed? And they're like, no, I'm in the middle of a med pass. Okay, cool. Like, bring your cart to the door, lock it. Let's go. Like, come on, Brenda.
Clap,
let's
clap.
go.
Like, oh my gosh. See, the way I always saw it was never look at yourself as superior because of your title, but look at it like any other workplace. You're because I don't know where I was like one of the newest employees there. Even after like 2 years in, because you go to long-term care homes, there's people who've been there for like 40 plus years. I see it as you always have to earn your stay, and, like, you're part of a team, and you have to, like, earn respect of the people who you're with. And you just want to help people. It makes things, and it's so much safer for the residents if you can do that, because, guys, let me tell you, if you start refusing your PSWs to reposition people, they're going to start doing it by themselves. They're either going to pull their back, or someone else is going to get hurt. And that's the reality. Like, we can't be here preaching always have 2 people on a mechanical lift, and then if you go, or if a PSW asks you for some help and then you deny them, then you don't preach that there should be 2 people, because they're just going to do by themselves, guys. Because
it literally takes 5 seconds, and if you don't do it, that person's going to fall trying to do it themselves. So just do it. It takes 5 seconds, honestly. I would tell my PSWs, I would say, are they hooked up? And if it was like a full lift, I would say, okay, put the sling under them, have them ready, and then when I walk in the door, we can lift them up. Like, have them ready,
Yeah.
And that's fair. If it was like a Sarah lift, a sit to stand lift, I would say, okay, sling them up, let's go. And we would just, like, real quick, 1, 2, it doesn't take long. Dang, Joe, you make me miss, like, the on-floor nursing days. Like,
Leanne, I'm so excited. So I got a position at a long-term care home, and I start end of March, and I literally just want to, and it's getting sunnier out now. So I'm starting to feel like a lot better, because I'm
Yeah.
actually seeing the sun, and I'm like, I just want to go. It's just down the road, and I'm like, I just want to go. And like, hey,
Yeah.
I'm here. Like, let's do it.
Yeah. That's
So
so
excited to
funny.
work.
I wish like with school and everything, like I just don't have time to have a casual position, and with like my full-time work too. But I do miss working on the floor, and it's something that like, I tell Ben about from time to time, like dealing being in a case management position is tough because I still get to advocate for clients, and I get to set up their care plans, and I get to, really make sure that they're receiving the care that they should be, but I don't get to do the hands-on stuff. And a
Mm,
part of me misses that, but then a part of me also, Joe, was like, when and this is partially due to COVID as well, like I was a robot. And we've talked about this, like come the end of COVID, like I was dragging my ass, and I had to take a month off before we even moved across the country, just to like take time for myself, to pack, to recoup from burnout, honestly. And I don't miss that side of it. I don't. Like I get to sleep a full 8 hours every night now, and I can work in my jammies from home if I want to, but like I don't get that client interaction every day that I miss. You know what I mean?
yeah,
There's definitely
totally,
perks to
totally.
to every position in nursing, and yeah, I definitely miss the like face to face, but I get to see the elderly folks whenever I do an intake, but
Hmm.
it's not quite the same, but I still enjoy my position.
COVID was super hard, and like long-term care nursing in general is just hard. And the one
Yeah.
thing that brings you up is the interaction with the residents. Like it evens everything out. Like it might be such a hard day, but then you just go sit down and have a tea with, one of your residents.
Yeah.
And it just makes it so much better, guys. Like it's such a rewarding job.
Well, it's funny that this like comes up because this is something like I've been thinking about a lot too, is like when I worked on the floor, Joe, like at 3 p.m., like I would leave and that was that. Like I would bring things home with me if there was a death or of someone like I really liked or whatever, that's always tough. But for the most part, like when I left, I could kind of let go of the day.
Hmm.
I knew that the nurses were taking over doing a good job. And in the position I'm the only case manager. So like I just feel like I put too much weight on my own shoulders. And so
Mm.
I basically told my boss today, I was like, listen, I know this is really last minute, but can I have Friday and Tuesday off so I can have an extra long weekend because we have family day off,
Oh,
and
when's Family Day?
Monday.
Like next
Eh,
Monday.
yeah, this Monday coming.
Oh, okay, nice. So that's when I'm going to Punta
Yeah.
Cana. Okay, nice. Sorry.
Woo!
Sorry, I didn't mean to hijack your story. Keep going.
No, it's fine. It's fine. Basically, I was just like, I need some time to like a couple extra days off, regain my work life balance. Like, I find myself on the weekends checking my work phone. Like,
Hmm.
I understand. Like, my boss is real good. She's like, if you put in hours on the weekend, just like start late on Monday or whatever, I'm salary. So basically, I can curate my schedule as I needed. But
Yeah.
for me personally, because I care, like I can't step back. And it's really frustrating because I want to make sure things are done properly, but I also need to like learn to let go, And so this is
Yeah.
something that I'm like working on, struggling with currently, but I told my boss, I was like, listen, like, please approve these days, please. She's like, yeah, take the days, no problem.
Oh, that's
Um,
awesome.
yeah, they're really great. But I'm coming to realize that every position comes with its own like ups and downs. Not that I've always put too much pressure on myself. Have
Hmm.
Is this a nurse thing? Do we all do that? Is it because I care too much?
I definitely do, and it stresses me the hell
Yeah,
out. Like I put so much pressure on myself, and sometimes it inhibits my ability to work as a team, because then
yeah,
I won't let go when someone else is trying to do their job. And that's actually
yeah,
so unhelpful, guys, because that's how mistakes happen. If someone else is trying to do their assessment and you're trying to butt in,
yeah,
they can't do the best job that they're doing. And it messes it up. And I've had it happen the same way. Like I'm trying to assess someone and someone keeps butting in and it's like back off because I can't do my job if
yeah,
you're so like worried about it. But I will say, Leanne, it's pretty awesome that you're identifying that, because I think that
Yeah.
that's the first step into, maybe mending this, right? Like, is to
Yeah.
recognize. I think
Yeah, of
that's very
course.
powerful, and you
And
should honestly pat yourself on the back for even asking for those couple days off.
yeah, I just like I haven't really had time off, Joe, since July. Like I've had a couple like Friday, Mondays off where I
It's
had
too long.
family come down, but
Yeah.
like I'm entertaining family. It's not where I get to do nothing. You know what I mean? Like I just
Yeah.
yeah, and yeah, I think that it definitely does take some like reflection to be able to say like, okay, like this is a lot, like I look at it, Joe, as if like a lot of my job here in Alberta is to help grow the business. And so like I do a lot of marketing and things like that on the side. And so Joe, it literally came to a point where I'm like, this is my company. Like that's how I feel. Like that's the weight I carry. Like if we don't succeed, it's because I'm a failure. And that's not true.
Nope.
That's not my responsibility. I am here to help build the business, but like it's not my business,
Yeah.
And I spoke with the RN manager over in BC today, and she basically just like reiterated everything for me. And she's like, I was where you were when we started here. And, she's like, what you're feeling is not abnormal. She's like, community is tough and we understand like you're doing a lot. And it just felt good to be validated, I guess, but I'm definitely looking forward to that time off. But I wish I was in Punta Cana. Jealous.
Dude, I am so pumped. So pumped. I'm going down for a wedding, and
So
it's really nice. And Taylor, if you're listening, I think so. My friend Taylor is getting married, and she messaged me today, and she's like, "I'm so jealous that you and Jelena are going on Monday because everybody's getting there on Wednesday," and I'm pumped because it's like a little vacation, and
Yeah.
I'm getting there before everyone else gets there. So we're gonna have like 2 solid days before everyone else gets there, just to like chill, like, because kind of like what you said earlier, like whenever you have family and friends over, you're still like exerting like energy, and
Yeah.
it's gonna be your wedding, so she's gonna get there, and we're gonna do like the rehearsal dinner and everything else. So we just get a couple days to chill. But she was messaging me today, and she's like, I'm so jealous because I think she's feeling that pressure if she's gonna get there, and it's just gonna be go go go. But yeah, I'm
for
so
sure.
pumped, so excited. I'm gonna try to take a bunch of pictures. I'm doing this thing, Leanne, where I'm not even gonna have my phone though. Like I might take like a few pictures, but like everything is just like I'm letting everyone know that like from the 20th to the 27th, you will not be able to reach me. Like
I love that.
Yeah.
I love that. Also, shout out to your friend Taylor. I see you liking our Instagram posts. I see you commenting.
We see you out here, girl.
We see you. Also, by the time you hear this, you might be married, so congratulations. Very exciting. Very exciting.
We will, from Nurses with Attitude will sponsor Taylor's wedding. Okay, I'm gonna go down there with Nurses with Attitude merch.
Oh my gosh,
it's gonna be a thing.
Listen, I said we were gonna start a YouTube, and I'm like over here, don't even know how to do anything technologically related. Guys, bear with us. Like I don't know what I'm doing. I ain't ever done a podcast before.
Right?
Don't know how this works. I'm just a millennial trying to make it through the world.
Literally, and not the cool millennials. Like I feel like me and you fall on the spectrum of millennials that don't really like know any like. Yeah. Anchor is such a great app because I literally, guys, I press 3 buttons and then we just start talking, and then I wait for it to process, that I post it.
Like the best thing is, Joe, too, is that we don't even edit our conversation. Like what you guys hear is literally our conversation. There's no cutting. There's no like adding.
This is raw, uncut material.
Are we like top of the line production?
Absolutely
not. Oh gosh. All right, I think that wraps up today's chat.
Yeah, that was solid.
Yeah. As always, guys, like we mentioned, hit us up on Instagram. Maybe we'll have a YouTube one day or another, but hit us up on Instagram, Nurses with Attitude, and thanks for listening, guys.
Thanks, guys. Peace.
Bye.